Medieval hygiene was not a collection of strange customs or forgotten routines. It was a slow, everyday breakdown of the human body, where unwashed skin festered for months beneath heavy layers of clothing, parasites became a constant part of life, and living spaces absorbed human waste so deeply that the smell of decay rose from the walls themselves. People didn't understand what was destroying them, because life in filth wasn't an accident or a failure. It was the foundation of their world, shaping how they suffered, how they weakened, and how they endured from birth to death. Medieval medical theory was built on fundamentally wrong ideas about how the human body worked, and one of the most damaging of these misconceptions was the belief that bathing with hot water was actively dangerous to your health. Physicians who had studied the ancient texts and who advised rulers and nobles taught that the skin had tiny invisible pores that normally stayed closed to protect the body's internal balance, but that hot water would force these pores open and create pathways through which diseases could enter directly into your flesh and organs. This was not considered a fringe theory or folk superstition. This was mainstream medical advice from the most educated doctors of the era, and people who could afford to follow medical recommendations took this warning seriously. The result was that regular bathing, especially full-body immersion in hot water, was seen as something that should be done rarely if at all, maybe a few times per year for special occasions, but definitely not as a routine practice. Instead of washing with water, medieval people were supposed to maintain cleanliness through dry methods that would not open those dangerous pores. The most common approach was to rub the skin with cloths, sometimes dry and sometimes soaked in substances like vinegar or wine, using friction to remove the visible dirt and dead skin without using the hot water that doctors warned against. Wealthy people who could afford more elaborate grooming would have servants rub their skin with cloths that had been treated with animal fat, the theory being that the fat would lift away dirt and absorb the bad humors that accumulated on the skin's surface. After this rubbing, powders made from various substances including ground minerals and dried flowers would be applied to cover any remaining odor or visible signs of skin problems. The fundamental issue with this approach was that rubbing with fat and powder does absolutely nothing to address the bacteria and fungi that grow on unwashed skin, so while a person might look cleaner and smell better temporarily, their skin would actually be getting progressively more diseased underneath the cosmetic layer. Infections would develop in hair follicles and in the creases where skin folded against itself, creating boils and abscesses that would fester for weeks or months. Fungal infections would spread across the skin in circular patterns, causing intense itching and flaking that the rubbing and powdering did nothing to cure. The armpits and groin, where moisture and warmth created perfect conditions for bacterial growth, would develop chronic infections that produced foul-smelling discharge and painful swelling that made movement difficult. These skin infections were so common that they were considered a normal part of life rather than a preventable problem, and medieval medicine had developed a whole arsenal of brutal treatments that were supposed to address the infections without resorting to the supposedly dangerous practice of bathing. The most straightforward approach for dealing with a large boil or abscess was to lance it with a hot blade, burning through the skin and releasing the pus in a procedure that was agonizingly painful and often led to worse infections afterward. Physicians would heat a metal instrument until it glowed red, then press it directly against the swollen infection, the heat both cutting through the skin and supposedly sterilizing the wound, though in reality the burned tissue just created dead flesh that was even more prone to becoming infected. Sulfur was another popular treatment, applied directly to open wounds and skin infections with the idea that its caustic properties would burn away the diseased tissue. The actual effect was chemical burns that destroyed healthy tissue along with infected areas, leaving scars and creating new wounds that would then become infected in their own turn. Some physicians believed that moldy bread or cloth could help heal wounds, and while they were accidentally correct that some molds have antibiotic properties, they had no way to distinguish beneficial molds from harmful ones, so this treatment was about as likely to introduce new infections as it was to cure existing ones. Urine, particularly urine that had been allowed to age until it became strongly acidic, was used as an antiseptic in wound wash under the theory that its acidity would kill disease-causing agents. While there was some minimal truth to this idea, the practice mostly just irritated damaged tissue and added the smell of stale piss to the existing odors of infection. Living in such a state of constant skin damage and unwashed layers of fabric created its own rhythm of daily discomfort, a slow grinding irritation that shaped how people experienced their own bodies from morning to night. It was a physical background noise that never stopped and that defined even the simplest moments of medieval life. Lice and other parasites were not an occasional problem in medieval life. They were a constant presence that everyone from peasants to nobility dealt with on a daily basis, and the lack of regular bathing combined with the practice of wearing multiple layers of clothing that were rarely washed created perfect conditions for these insects to thrive. Head lice were so universal that special combs made from ivory or bone with very fine teeth were standard grooming tools that wealthy people would use every single morning to scrape the insects and their eggs from their scalps. This was not a quick process. It required sitting still while a servant worked through your hair section by section, dragging the comb through to catch the lice and pulling out the nits that were glued to individual hair shafts. The insects removed during these sessions would be crushed or burned, but there were always more the next day because the conditions that allowed them to thrive had not changed. Body lice and pubic lice were equally common and equally difficult to control, living in the seams and folds of clothing and in body hair, feeding on blood and reproducing faster than they could be manually removed. The itching from lice bites was constant and maddening, and scratching would break the skin and create entry points for secondary infections that would add infected sores to the existing torment of the parasites themselves. Fleas were another universal companion, particularly for people who lived in close quarters with animals, and these insects could jump from host to host spreading disease while also creating intensely itchy bites that would become infected when scratched. But beyond the common lice and fleas, medieval people also dealt with more serious parasitic infections including scabies mites that would burrow into the skin and create tracts of inflamed tissue that itched worse than any insect bite. These microscopic parasites would tunnel through the upper layers of skin, laying eggs and creating an infestation that could spread across the entire body and that was incredibly difficult to eliminate without proper hygiene and treatment. The scratching that scabies caused would tear open the skin and create weeping sores that would become infected, and the whole thing could persist for months or years if not properly treated. Medieval treatments for scabies and other skin parasites were brutal and often more damaging than the original problem. One common approach was to scrape the infected skin with a blade or rough stone, physically removing the outer layers of tissue where the parasites lived but also creating raw wounds that were prone to serious infections. Another treatment involved applying caustic substances like lime or wood ash directly to the skin, the idea being that the chemical burn would kill the parasites, though it would also destroy healthy tissue and leave permanent scars. Hot tar or pitch was sometimes used to coat infected areas, suffocating the parasites but also burning the skin and creating a layer of contaminated material that was difficult to remove and that often led to worse infections. Some physicians would recommend sulfur ointments or mercury compounds, both of which were toxic and caused their own set of problems even as they killed some of the parasites. The cumulative effect of living with constant parasitic infestation was chronic skin damage that made people more vulnerable to serious diseases, because the broken skin from scratching and the infections from secondary bacterial growth created pathways for more dangerous pathogens to enter the body. The bites from lice and fleas could transmit typhus and plague, diseases that killed millions during medieval outbreaks, and the constant immune system stress from fighting off parasites and skin infections left people weakened and more susceptible to any illness they encountered. And over the years this steady assault on the surface of the body dulled people's awareness of where one form of pain ended and another began, allowing deeper, more hidden problems to take root unnoticed, problems that slowly reshaped the inside of the body just as relentlessly as parasites tormented its surface. Medieval dental care was a horror show of pain and progressive destruction that left most people with damaged or missing teeth by middle age, and the lack of proper oral hygiene combined with diets high in coarse grains and limited medical knowledge created a perfect storm of dental disasters. The most common tool for cleaning teeth was a small twig or stick with frayed ends that would be rubbed against the teeth to remove visible food particles and some of the buildup that accumulated on tooth surfaces. Some people would enhance this by dipping the stick in salt or in mixtures of ground minerals that were supposed to clean and whiten teeth, but these abrasive substances actually wore away tooth enamel over time, making the teeth more vulnerable to decay and sensitivity. Without enamel protection, the softer dentin underneath would be exposed to bacteria and acids from food, leading to cavities that would progress deep into the tooth and eventually reach the nerve, creating excruciating pain that medieval medicine had no effective way to address. The only real solution for a severely decayed or infected tooth was extraction, and this was done without any anesthesia beyond possibly getting the patient drunk enough that the pain would be somewhat dulled. The barber or physician performing the extraction would use metal forceps to grip the visible part of the tooth and then pull with enough force to break the roots free from the jawbone, a process that was agonizingly painful and that often resulted in the tooth breaking apart rather than coming out cleanly. If the tooth shattered during extraction, pieces of root would be left behind in the gum where they would become infected and create abscesses that could spread to the jawbone itself. These dental infections were serious medical emergencies that could be fatal if the infection spread to the bloodstream or the brain, and medieval physicians had no antibiotics or effective treatments beyond draining the pus and hoping the body could fight off the infection on its own. The cumulative effect of years of poor dental hygiene and crude dental work was that most medieval people lost many of their teeth well before old age, making eating difficult and limiting their diet to soft foods that required minimal chewing. Missing teeth also affected speech and appearance, and the chronic infections in the mouth contributed to bad breath that was so universal that it was just accepted as normal. Gum disease was extremely common, with the gums becoming inflamed and infected and slowly receding to expose more of the tooth root, making the remaining teeth loose and eventually causing them to fall out even without active decay. The pain from dental problems was a constant background misery for many people, affecting their ability to eat, sleep, and concentrate on anything else, and there was no real solution available beyond extraction of the worst teeth and simply enduring the discomfort from the rest. And all of this unfolded inside living environments that offered little relief of their own, places where the air, the walls, and even the floors quietly worked against the health of the people who depended on them, turning daily life into a struggle that extended far beyond the limits of the human body. The sanitation systems in medieval castles and fortified residences were primitive even by contemporary standards, and the way human waste was handled created serious health hazards that contributed to disease outbreaks and chronic illness among the people living in these supposedly prestigious locations. The typical castle toilet was a small room with a hole cut in a stone bench, and this hole opened directly onto a vertical shaft that ran down through the castle wall and either emptied into the moat or river below, or in many cases simply deposited waste into a pit at the base of the wall. These shafts would accumulate waste over time, and without any system for regular cleaning or removal, they would eventually fill up to the point where the toilet became unusable. When this happened, the usual solution was to close off that toilet and build a new one elsewhere, leaving the filled shaft to sit there indefinitely with its load of decomposing human waste. The problem was that these waste-filled shafts did not just sit there inertly. The decomposition process created gases and liquids that would seep through the stone walls and wooden floors into adjacent rooms, bringing foul odors and disease-causing bacteria into living spaces. In many castles, waste shafts would be built directly adjacent to or even underneath residential chambers, and the people living in these rooms would be constantly exposed to the products of decomposition filtering up through the floors and walls. The smell alone was bad enough, but worse was the fact that this exposure created ideal conditions for intestinal diseases to spread through the castle population. Dysentery and other gastrointestinal infections were common in castles precisely because the sanitation system was continuously contaminating the living environment with fecal bacteria. Water supplies were particularly vulnerable to this contamination, because many castles relied on wells or cisterns that were located too close to the waste disposal areas, and the liquid byproducts of decomposing sewage would seep through the ground and contaminate the drinking water that everyone in the castle used. Regular outbreaks of waterborne illness would sweep through castle populations, causing severe diarrhea and vomiting that could be fatal, especially for children and elderly people whose immune systems could not handle the onslaught. The castle's leaders and nobility were not immune to these problems despite their privileged status, because they were living in the same contaminated environment as everyone else, just in slightly nicer rooms. When important political or military events required the presence of many people in a castle for extended periods, the strain on the primitive sanitation system would intensify all these problems, leading to epidemic outbreaks that could decimate the assembled nobles and officials. There are documented cases of major political gatherings being disrupted or ended early because disease swept through the castle and killed or incapacitated significant numbers of the attendees, demonstrating how the failure of basic sanitation could have direct political consequences. Such conditions seeped quietly into every corner of public life, shaping decisions in ways that few acknowledged, and leaving those in power to navigate a world where illness did not simply appear, it accumulated, settled, and altered the ground beneath their feet. The cumulative effect of medieval hygiene practices, or rather the lack of proper hygiene, was not just individual suffering but had direct and significant impact on political power and the functioning of governments. Rulers and their close advisors were constantly dealing with health problems that stemmed directly from the filthy conditions they lived in, and these health issues would regularly prevent them from performing their duties or would kill them outright at crucial moments in history. Skin infections were so common among the ruling classes that having a body covered in boils and abscesses was essentially normal. But when these infections became severe enough they could make it physically impossible for a leader to sit on a throne for extended periods, to ride a horse for military campaigns, or even to dress in the formal clothing required for ceremonies. Chronicles from the medieval period are full of references to kings and nobles who had to cancel important meetings or delay military operations because they were incapacitated by infected sores that made movement agonizing. Intestinal diseases from contaminated water and food were another constant threat that could strike down even the most powerful leaders, and the severe diarrhea and dehydration from dysentery or cholera could kill within days or leave survivors weakened for months. There are multiple documented cases of succession crises that occurred because a ruler died suddenly from intestinal disease during a critical political moment, leaving power vacuums that led to civil wars or foreign invasions. The chronic nature of poor health in medieval courts meant that many rulers were operating at diminished capacity for significant portions of their reigns, unable to think clearly or make decisions effectively because they were in constant pain or weakened by chronic illness. This created opportunities for advisors and nobles to seize effective control of government while maintaining the fiction that the official ruler was still in charge, and it meant that many important political decisions were being made by people who were themselves suffering from the same health problems that affected everyone in their disease-ridden environment. The lack of basic hygiene also affected military capabilities, because armies operating in the field with no sanitation and no clean water would regularly lose more soldiers to disease than to combat. Medieval military campaigns were often decided not by superior tactics or equipment but by which army managed to avoid devastating outbreaks of dysentery or typhus for longer than their opponents. A castle under siege might hold out against military assault but surrender when disease tore through the defenders and left them too weak to man the walls. The political map of medieval territories was shaped in part by these invisible factors of disease and poor hygiene that could wipe out defending forces or kill attacking armies depending on the accidents of water contamination and disease transmission. Looking at medieval history through the lens of hygiene and disease reveals that what we think of as political or military history was actually being driven to a significant degree by the consequences of living in filth, and that the rulers who managed to stay healthy enough to govern effectively had as much advantage over their rivals as those with larger armies or more gold. And in the end, What remained was a world where power, survival, and decay were bound together so tightly that no ruler could fully escape the conditions that shaped their life from birth to death, leaving the marks of dirt and disease etched not only on the body but on the course of history itself.